A patient presents a prescription for amoxicillin 250 mg per 5 ml suspension, 300 mg 3 times daily for 10 days. How many milliliters of suspension are needed to fill the prescription? A. 150 milliliters. B. 180 milliliters. C. 200 milliliters. D. 300 milliliters. Answer, B. Each dose equals 300 milligrams. Since suspension is 250 milligrams per 5 milliliters, 300 milligrams equals 6 milliliters. 3 doses daily equals 18 milliliters per day times 10 days equals 180 milliliters. A patient allergic to sulfa drugs is prescribed a medication. Which of the following must the pharmacy technician verify with the pharmacist? A. Hydrochlorothiazide. B. Ciprofloxacin. C. Amoxicillin. D. Metformin. Answer, A. Hydrochlorothiazide is a sulfonamide-derived diuretic and can cause cross-reactivity in patients with sulfa allergy. Which DEA form is required to destroy outdated controlled substances in a retail pharmacy? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer, A. DEA Form 41 documents the destruction of expired or damaged controlled substances. Which force solution is considered isotonic and safe for most fluid replacement? A. 0.9% sodium chloride. B. 0.45% sodium chloride. C. 5% dextrose in water. D. 3% sodium chloride. Answer, A. 0.9% NaCl, normal saline, is isotonic and commonly used for hydration. A patient receives a prescription for warfarin. Which over-the-counter product should the technician flag for pharmacist counseling due to increased bleeding risk? A. Vitamin C. B. Ginkgo biloba. C. Calcium carbonate. D. Vitamin D. Answer, B. Ginkgo biloba has antiplatelet effects and can increase bleeding risk with warfarin. Which of the following routes of administration provides the fastest onset of action? A. Oral. B. Intravenous. C. Intramuscular. D. Subcutaneous. Answer, B. For administration delivers medication directly into the bloodstream, producing the fastest effect. A physician prescribes levothyroxine 0.075 mg daily. Which strength should the technician select from stock bottles? A. 50 micrograms. B. 75 micrograms. C. 100 micrograms. D. 150 micrograms. Answer, B. 0.075 mg equals 75 micrograms. Which medication requires refrigeration before dispensing? A. Lisinopril tablets. B. Insulin glargine vials. C. Lorazepam tablets. D. Warfarin tablets. Answer, B. Insulin products must be refrigerated until use to maintain potency. Which drug is classified as a Schedule II controlled substance? A. Alprazolam. B. Hydrocodone with acetaminophen. C. Codeine cough syrup. D. Morphine. Answer, D. Morphine is a Schedule II narcotic, alprazolam is C4, codeine cough syrup CV, hydrocodone combinations are also C2. A technician must calculate the day's supply for a prescription, metformin 500 mg, 2 tablets twice daily, quantity 120. A. 15 days. B. 30 days. C. 45 days. D. 60 days. Answer, B. Daily dose equals 4 tablets. 120 divided by 4 is equal to 30 days. Which of the following drugs is an example of a high-alert medication due to risk of serious harm if misused? A. Metformin. B. Insulin. C. Lisinopril. D. Atorvastatin. Answer, B. Insulin errors can lead to severe hypoglycemia and even death. Which strategy reduces the risk of dispensing errors in a busy pharmacy? A. Overlapping tasks to save time. B. Tall man lettering for look-alike drugs. C. Ignoring brand names. D. Using abbreviations freely. Answer, B. Tall man lettering, e.g., hydroxyzine versus hydralazine, highlights drug differences to prevent confusion. Which medication requires a patient package insert, PPI, each time it is dispensed? A. Metoprolol. B. Isotretinoin. C. Atorvastatin. D. Hydrochlorothiazide. Answer, B. Isotretinoin requires a PPI due to teratogenic risk under the iPledge program. A patient is prescribed gentamicin for. Which monitoring is most important due to toxicity risk? A. Blood pressure. B. Liver enzymes. C. Renal function. D. Glucose levels. Answer, C. Aminoglycosides like gentamicin are nephrotoxic. Kidney function must be monitored. Which of the following dosage forms bypasses first-pass metabolism? A. Oral tablets. B. Transdermal patches. C. Chewable tablets. D. Extended-release capsules. Answer, B. Transdermal delivery avoids hepatic first-pass effect, increasing systemic bioavailability. A technician receives a prescription for albuterol HFA inhaler with 2 puffs every 4 hours PRN wheezing. How many inhalers, 200 puffs each, are needed for 30 days if used at maximum frequency? A. 1 inhaler. B. 2 inhalers. C. 3 inhalers. D. 4 inhalers. Answer, C. 2 puffs times 6 doses/day equals 12 puffs/day. 30 days equals 360 puffs. 360 divided by 200 is equal to 1.82 inhalers, but with max PRN usage, 3 inhalers ensure coverage. Which law requires pharmacists to provide counseling for Medicaid patients? A. OBRA 90. B. FDCA. C. Controlled Substances Act. D. Durham-Humphrey Amendment. Answer, A. OBRA 90 mandates drug utilization review and counseling for Medicaid patients. Which auxiliary label is appropriate for metronidazole? A. Avoid prolonged exposure to sunlight. B. Do not drink alcohol. C. May cause drowsiness. D. Take with food or milk. Answer, B. Alcohol with metronidazole can cause a severe disulfiram-like reaction. Which type of drug recall is issued when use of a drug may cause serious health problems or death? A. Class 1. B. Class 2. C. Class 3. D. Market withdrawal. Answer, A. Class 1 recall is the most serious, indicating life-threatening risk. A technician receives a prescription for ciprofloxacin 500 mg PO bid times 7 days. What total number of tablets is required? A. 7. B. 10. C. 14. D. 20. Answer, C. 2 tablets daily times 7 days equals 14 tablets. A multi-dose vial is opened on July 12, 2025, with a 28-day beyond use date. What is the last safe day of use? A. August 8, 2025. B. August 9, 2025. C. August 10, 2025. D. August 11, 2025. Answer, B. The 28-day count starts the day after opening, making August 9, 2025, the final usable day. When compounding a sterile product in a laminar airflow hood, which of the following practices most increases the risk of contamination? A. Placing hands at least 6 inches inside the hood. B. Blocking airflow by placing supplies directly in front of critical sites. C. Wiping vials with 70% isopropyl alcohol before use. D. Using sterile syringes for each preparation. Answer, B. Blocking airflow disrupts first air and increases contamination risk. Maintaining unobstructed airflow is critical in aseptic compounding. A patient's prescription reads levothyroxine 0.075 mg. Which of the following is the correct equivalent strength on the pharmacy label? A. 25 micrograms. B. 50 micrograms. C. 75 micrograms. D. 100 micrograms. Answer, C. 0.075 mg equals 75 micrograms. Converting correctly avoids dosing errors in thyroid medication, which has a narrow therapeutic index. A patient presents a prescription for warfarin 5 mg daily. The technician notices the patient is also purchasing OTC aspirin. What should the technician do? A. Dispense both without concern. B. Warn the patient that aspirin may increase bleeding risk and notify the pharmacist. C. Refuse to sell the aspirin. D. Substitute acetaminophen without consultation. Answer, B. Aspirin can increase bleeding risk with warfarin. Technicians must flag the interaction and inform the pharmacist for counseling. A prescription is written for azithromycin suspension 200 mg per 5 ml. Take 5 ml on day 1, then 2.5 ml daily on days 2 to 5. How many milliliters total should be dispensed? A. 12.5 milliliters. B. 15 milliliters. C. 20 milliliters. D. 25 milliliters. Answer, C. Day 1 is equal to 5 ml, days 2 to 5 equals 2.5 milliliters times 4 is equal to 10 ml. Total equals 15 milliliters. To ensure coverage, 20 milliliters bottle is dispensed to avoid underfill. A patient asks why their new extended-release capsule should not be crushed. What is the correct explanation? A. Crushing increases the drug's absorption. B. Crushing may cause dose dumping, releasing too much drug at once. C. Crushing has no significant impact on therapy. D. Crushing makes the drug taste better. Answer, B. Extended-release formulations are designed for gradual release. Crushing breaks the controlled mechanism, causing toxicity. A prescription order requires 120 milliliters of a liquid medication. The stock available is 480 milliliters bottles. How many full doses can be prepared if each patient dose requires 15 milliliters? A. 24 doses. B. 30 doses. C. 32 doses. D. 36 doses. Answer, C. 480 divided by 15 is equal to 32 doses. Pharmacy technicians must calculate accurately to determine how many full doses can be prepared from stock. Which of the following is an example of a high-alert medication according to ISMP that requires extra safety checks in pharmacy practice? A. Loratadine. B. Metformin. C. Insulin. D. Amoxicillin. Answer, C. High-alert drugs like insulin have a high risk of causing patient harm if used incorrectly, requiring double checks in dispensing. A prescription is written for a controlled substance C2. The patient asks if they can get it refilled automatically. What should the technician explain? A. C2 medications can be refilled once with pharmacist approval. B. C2 medications cannot be refilled by law. C. C2 medications can be refilled if less than 30 days old. D. C2 medications can be refilled only with DEA permission. Answer, B. By federal law, C2 drugs, like opioids and stimulants, cannot be refilled. A new prescription is required for each fill. A patient's profile shows an allergy to penicillin. Which antibiotic should the technician flag for possible cross-sensitivity? A. Cephalexin. B. Azithromycin. C. Ciprofloxacin. D. Doxycycline. Answer A. Cephalosporins, like cephalexin, may cause allergic reactions in patients with penicillin allergies due to structural similarity.